So I'm a diabetic being told I need surgery for a severe bunion, but I've read that diabetics have much higher rates of wound healing complications and infection after foot surgery. Is it safe for me to get a bunion surgery, or is it something that I just kind of have to deal with? Hi, my name is Dr. Katelyn Testa. I'm one of the doctors here at Essex Union Podiatry, and today I'm answering some questions that we frequently get from patients. So the concern in a diabetic patient reflects a genuine risk of satisfaction and safety that every diabetic surgical patient deserves. I can measure whether or not a patient is a good candidate for surgery by looking at a multitude of things. Do they have sensation? How is their blood flow? What do their labs look like? What's their hemoglobin A1C? So when we look at hemoglobin A1C, if a patient is under 7%, it's generally safe and they have good blood flow. It's safe to do that surgery. With a hemoglobin A1C above 7 into the 9% and higher, we get nervous and we kind of will refrain from doing surgery in that patient until they get their blood sugar under control. Here at EUP, we make sure that when we're talking about surgery in a diabetic or a high-risk population, we're looking at all of these factors. We're looking at their lab work, we're looking at their lifestyle, and what things will look like for them after surgery. We're getting the images, we're getting consults from their primary doctor, from those endocrinologists to make sure that doing surgery on them is truly going to be the safest thing. But for a patient who has a history of diabetes that's well controlled and they need a bunion surgery, I'll go ahead as long as everything is good and as long as the patients truly do understand the risks associated with getting a bunion surgery.